Assalamu alaikum. Welcome to another episode of Ramadan in Sync. Optimize your energy and health in Ramadan. I'm Dr. Sadia Mia, endocrinologist, certified in functional medicine, and certified life coach, author of The Crowning Venture, Inspiration from Women Who Have Memorized the Quran, and my upcoming book, Hormones in Sync. Disclaimer. The information shared in this series is for educational purposes only and is not intended as medical advice, diagnosis, or treatment. Every individual's health needs are unique. Before making any changes to your medication, supplements, diet, fasting practices, or overall health routine, please consult your personal physician or qualified healthcare provider. Remember, we were talking about energy, one of the biggest health challenges people experience during Ramadan, something that people want more of to make the most of this amazing month. Before we get into lifestyle and nutrition strategies, I always like to start by making sure we're not missing simple, correctable issues that can significantly affect energy. For example, some people are low in vitamin D, have iron deficiency anemia, or low vitamin B12. These are common and they can strongly impact how you feel day to day. They're often straightforward to address. It's important to identify these first so we're not trying to optimize everything else and put in all this hard work while something like this is sabotaging all our efforts. When somebody feels persistently fatigued, I usually recommend a basic set of labs to evaluate energy. The first is a CBC or complete blood count, along with iron studies, which includes ferritin, which is the storage form of iron. And this is especially important for women who have heavy menstrual cycles where iron deficiency and anemia are common. However, other people can have this as well. I also recommend checking vitamin D and B12 levels. Many people have low vitamin D, particularly in the winter months when sunlight exposure is limited, since the skin relies on sunlight to produce vitamin D that the body then activates and uses. Vitamin B12 is also essential for energy and neurologic function. Thyroid function is also important. Many people don't realize that they actually do have a thyroid issue going on. And a good starting point is checking three labs, which are basic foundational labs for the thyroid: the TSH, which is thyroid stimulating hormone, the free T4, and the free T3. These give us an overview of how the thyroid is signaling and how much active of hormone is available. Another lab that is important is a comprehensive metabolic panel. It can be helpful because it gives us information about blood glucose levels, and it also provides a general window into liver and kidney function and overall health of the body. One area that is very often missed is insulin resistance. Some people have diabetes, and it's very clear whether or not they can fast. They need to talk with their physician about that. Some have pre-diabetes, and yet there's so many people who are in earlier stages of insulin resistance, even before there's any changes in their labs. Sometimes before seeing a high hemoglobin A1C, we might see a high insulin level, which gives us a window into is there insulin resistance or not. But actually, I can usually tell by just looking at my patient and doing a good physical exam to see if there are signs of insulin resistance. And this can actually contribute to fatigue because the fluctuations in blood sugar and insulin levels can deplete the body. It just makes people feel very tired with the blood sugars going sometimes very high and going sometimes very low. And in fact, the hypoglycemia can sometimes be more of a problem initially than the hyperglycemia. And so people may experience episodes where their blood sugar drops suddenly and they feel shaky, sweaty, or intensely hungry, and then they feel better quickly after eating. This can be an early cue, and I always ask my patients about that. So we often see insulin resistance and these kinds of symptoms in patients who have PCOS or polycystic ovarian syndrome, which is a syndrome of insulin resistance. In some individuals, these blood sugar swings can also trigger headaches and make fasting more difficult. It's very important to speak with your own physician to find strategies to help you feel better and also to ensure that you're able to fast safely. Another lab I added here is a lipid panel, which is not necessarily urgent to do before Ramadan, but it gives a broader picture of metabolic health. So I'd like to look at the patient as a whole and their overall metabolic health. And now you might be wondering what to do if Ramadan has already started and labs have not been checked. There's two things to keep in mind. First of all, many people already know if they have low vitamin D, if they're anemic, or if they've had low vitamin B12 in the past. And sometimes they just lose the habit of taking these vitamins or don't realize how important they can be towards energy. And so it's important to just become more regular with taking the vitamin supplements, or if you happen to be on some kind of medication for the thyroid. And second, if someone is truly not feeling well, having blood drawn during Ramadan, it does not break the fast. So I don't recommend unnecessary testing during Ramadan, but if labs are medically needed and a person is not feeling well, they can be done while fasting. So starting with these fundamentals helps to ensure that we are supporting energy at the root and not just layering different lifestyle strategies on top of issues that are very correctable. I'll see you next time as we continue our series, Ramadan in Sync.